back. We have Dr. Bob Rishiraj joining us, who will be joining us every month for the next little while to talk a little bit about your oral health. We'll have various topics for you. Of course, Dr. Rishiraj, an oral facial specialist. Thanks for being here.
Thank you.
I know you're busy, so we appreciate you taking your time out of your day to be here. And we want to start really right off the bat with your specialty, Dr. Rishiraj, and that's wisdom teeth.
Right. So that's our bread and butter in the office.
Yeah.
So wisdom teeth is commonly, they're taken out simply because there's lack of space and the inability of the patients to keep the mouth clean.
Right.
As we all know, the mouth is full of bacteria, and they can harbor in any nook and cranny. And when you have an area that's not being cleansed properly or have the inability to keep it clean, the bacteria reside in that area and cause problems. Usually starts with pain. Sometimes it'll even progress to people having cavities, infections, abscesses. Abscesses can travel down the neck and can become problematic. And that's one of the reasons we recommend wisdom teeth be taken out, usually the teenage years.
Yeah.
And because they become problematic most times at that age. And sometimes we do take them out later, but usually if they're only problematic.
Okay, so it's not always that everyone, at least from what I've heard, not everybody's wisdom teeth actually come all the way in. But you still recommend taking them out if they start to cause problems, because they still can cause problems even if they haven't actually come through, right?
Right. So infection is one of the big things, but the other thing that can happen is if the teeth are malaligned in the mouth and they cannot make it through the jaw, whether it's the lower or the upper jaw, they can cause problems for the adjacent teeth.
Okay.
One of the big problems that can occur is when you can't keep it clean, food and bacteria will reside in that area, thus causing cavities.
Right.
So if the cavity is too far below the gum line, the patient is not aware of it, then what ends up happening is to get a cavity. And then that tooth may not be fixable. If it's not fixable, then it has to be taken out, as well as possibly the wisdom tooth.
Okay.
So it makes more sense prophylactically to get the wisdom teeth out at a young age so that you don't have problems later. The other problem that occurs, and it occurs in about 1% of the people that have impacted wisdom teeth. I should mention the word impacted means a tooth does not have a proper way of getting into the mouth, cannot erupt into the mouth, whether it's the tooth ahead of it or the overlying bone, which can play a role. So an impacted tooth is one that usually becomes problematic as the area does not stay clean. But because it can cause more damage to the adjacent tooth or bone, then it becomes a problem. Now, the problem that occurs is if you have an impacted tooth, and I just had a 79-year-old.
Yeah, we've got some pictures. Let's put these up.
So there was
Maybe
a 79-year-old. So here's a patient that just came in about 2.5 weeks ago, and the patient, if you look around the teeth, there's a little bit of a darkening around the tooth. Those are cysts that have shown up on the x-ray, and the patient was having difficulty with just pain, and he got to a point where he said, I just need these out.
Yeah.
So impacted teeth, if they're left in, have a 1% chance of having pathology around it, which involves having cysts. So this is the same patient with the teeth out, and you can see that the area is all cleaned up. In about 6 months to a year, that bone will really fill in, and the patient really won't know what was there.
This
Now,
is your favorite patient.
This is my favorite patient. This is our friend Tanya.
These are mine. This is from 2010, I think. Isn't that when I got my wisdom teeth out?
That's right.
Yeah.
So you can see how the teeth can be impacted. They can be rotated towards the middle of the mouth. They can be high up in the mouth. And, you know, when you have that, they cause problems. And I think that's one of the reasons you came in, is because you were starting to have some issues.
Yeah.
And as the issues continue, and they don't typically go away for a prolonged period of time, the teeth need to be taken out.
All right. Well, I don't think this will be the last time we talk to you about wisdom teeth, Dr. Rishiraj, but of course we're going to have different topics every time you come on the show. But we will mention as well, Dr. Rishiraj is holding a free information seminar on implants at his office on Columbia Street, November 2nd from 9 until 11. If you want details on that, you can check out his website, Kamloops oralsurgery.com, or of course give them a phone call as well with all the details. They'll have them there for you. Great. Thank you for being here. We really appreciate that.
Thank you. Thank you for having me.
We'll see you soon. We'll be right back after a break on Midday. Stay with us.